Hi, I'm Dr. Josef Witt-Doerring. I'm a board-certified psychiatrist and expert in drug tapering and psychiatric side effect management. Today I'm going to be talking about the 5 reasons why you might want to avoid long-term use of antidepressants. And these are things that your doctor may not have discussed with you. Before I launch into this video and specifically address the reasons to consider avoiding long-term use with antidepressants, I want to emphasize that this video really is about the long-term use of them because, in my perspective anyway, I think they actually make a lot more sense short-term. I mean, they're still not risk-free short-term, but short-term use seems to make a lot more sense to me than long-term use. And so if you stick around to the end of this video, I'm going to talk about how I think they should be used and when I think long-term use is appropriate. And so reason number 1, this is the reason that applies to everyone. They don't get to the root cause. To first understand this, you need to understand a little bit about the causes of depression. Something I want to address is that, firstly, there's no chemical imbalance. This is widely acknowledged by the research community now. No one's ever found an imbalance in serotonin that these drugs are improving, but that doesn't necessarily mean there's not a genetic component. And I do believe there is a partial genetic component to depression, and it has to do with trait neuroticism. These are people that tend to be more anxious. And when we've looked at genetic studies of these folks, they just tend to respond to life stresses in a more substantial way, and they're more likely to become depressed. That said, if these people don't go through a lot of life stresses, they actually are quite resilient and they don't become depressed. And so the main thing that really impacts depression is the stresses in the person's life. So there's lots of evidence that show that stresses like death of a loved one, financial stress, prior trauma, poverty, lack of purpose, and such, that these all contribute to depression, difficulty with relationships. And even there's medical problems and dietary problems that are known to impact depression and anxiety. Things like autoimmune conditions really have a strong association with depression as well. And what I can say is, having worked in this field for nearly 10 years, I struggle to remember ever meeting someone that didn't have a really good reason for why they were depressed. I haven't seen this person who walked in and I was just like, well, everything's in order, you've tried everything, and I still don't know why you're depressed. And so what I suspect is going on for a lot of people who go and see their doctors is that they have this sort of conveyor belt-like experience when they go into the office, they meet the doctor for 25 minutes, they fill out a questionnaire for depression, and they essentially just get on the drug. And the truth is that the doctor doesn't really know much about their patient. They haven't looked at the reasons they're depressed. They haven't looked at their diet. They haven't looked at their medical conditions. But because the setting is so rushed, they just end up prescribing them this medication. And essentially, when you treat someone in that way, by not getting to the root cause, you're not really helping them. It's almost like you're kind of knocking the batteries out of the smoke detector for that person. And that can lead to a festering of the problem, essentially. Like, imagine if you were in like an abusive relationship because you had some maladaptive traits and you were bad with boundaries, and you were getting signals from your brain that this wasn't good, and you went to see a doctor and they told you had a chemical imbalance and put you on an antidepressant. Your life is not going to improve because of that. You might actually become more complacent in that environment. And I know that's one example, but that's going to be true for, like, what if you were having depression from a medical problem and you had some autoimmune condition and might have been fixed by going on a certain diet? That could have been really helpful. That's my number one problem with it, is that they don't get to the underlying cause. And the way our medical system is set up right now is, doctors really aren't looking for them. So the second issue is that you're never going to get used to handling your full range of emotions. So one of the reasons you might want to be wary of long-term use of antidepressants is they're going to mute your full range of emotions. This is in fact their primary therapeutic effect. And having spoken to thousands of people on antidepressants and having taken them myself, the clearest way I can describe their effect is that they induce an emotional constriction. And that is, you don't feel your full range of emotions. It constricts the highs and the lows. Now, while this can be helpful, especially if someone is severely anxious and unable to function due to the anxiety, it becomes problematic in the long term because these drugs are not selective in how they blunt your emotions. For example, some people report disliking the global blunting of these medications. They'll say they can't cry in sad movies or even at funerals. And many artistic people say that they actually begin to struggle to access the same level of artistic creativity that they had previously. Others feel less motivated to do things like exercise or socialize, even though that they know that they should. They're just not feeling those feelings kind of bubble up within them and motivate them the way they used to. Some people dislike how these meds reduce their level of emotional attunement to others. They find themselves less sensitive to the emotional states of those around them, like their partners or their children, and they sometimes struggle to manage these relationships as effectively when they're on these meds. Because the truth is that taking an antidepressant acts like a cast for a broken arm. They can be beneficial at the start if you are so anxious or overwhelmed that you need something to restrict your emotional range. But just like a cast, if you leave it on long term, it's going to be bad for you. For those of you who've had a broken arm before, I know I have, when you leave a cast on too long, the muscles in your arm actually begin to atrophy and weaken. And this is exactly what will happen with long-term antidepressant use. As you take these long-term, you're going to start to lose your ability to function with your full range of emotional and cognitive abilities. And if you take antidepressants long-term to mute your anxiety, the collateral effects is a muting of these other cognitive and emotional systems. And this can be detrimental because your cognitive and emotional functioning is really there to help you navigate the world in the most effective way possible. Now we're going to talk about the tolerance problem. Now this is the next reason you may want to not consider taking antidepressants long term. Antidepressants work primarily by disrupting our neurotransmitter systems. That's how they produce their unique drug effect of emotional constriction. However, what is often forgotten is that these neurotransmitter systems are not just involved in the functioning of our mood, but they're also involved in the global regulation and functioning of multiple systems throughout our body. Our digestive system and also our cardiovascular system, our hematologic system. These chemical messengers, they're involved in all of that. And when you take these drugs, these systems don't appreciate being thrown out of balance. And as a result, something called homeostasis kicks in. And now homeostasis refers to the adaptive changes in the body designed to counteract the effect of these drugs. So what happens with the antidepressants is that the brain changes to counteract the effect of these drugs on the body. This is why many people find that they work well for a short period of time, and then later they only partially work, or they even start to struggle to identify what the drug is really doing. Consequently, for some people who really need the potent and acute effects of the medication to help them, they begin to feel like the drug simply isn't working anymore, and they start to gradually increase their dose. However, with each increase, further tolerance develops, and they get used to the higher dose, and eventually they can't increase the dose anymore. And then they need to add another drug. And this is how some people start with one drug, and before long, they end up on 3 or 4 different antidepressant medications. Fortunately, once they're on 3 or 4 different medications and their body has adapted to them, they're having multiple side effects, or they might even feel worse due to the unpredictable effect of having 3 to 4 medications fluctuating at different levels throughout their bloodstream during the day. In many cases, I've seen people in this situation get diagnosed with treatment-resistant depression, and then get started on increasingly risky treatments such as TMS, ketamine, or even ECT. In addition, clearly once you're on this many medications, it can be really challenging to get off them safely. Now, the next reason you might want to avoid long-term antidepressant use is the side effect profile. This video is too long to discuss all of them, but I'm going to touch on a few that tend to be the most important for people. So the first is the sexual side effects. Many people struggle to enjoy intimacy in the same way as before they got on the meds once they start the antidepressants. This can impact someone's self-esteem, but also their relationship. And in uncommon instances, the sexual dysfunction does not resolve when people come off these meds. It can actually be enduring and last for years. The second issue a lot of people seem to have problems with, which is very legitimate, are the metabolic side effects of antidepressants. These can include problems like weight gain, higher lipid levels, higher blood glucose, and some of these are especially problematic with the antipsychotic medications that are typically used as antidepressants, things like Seroquel or olanzapine. Given the seriousness of these side effects, which both impair the quality of your life but also potentially shorten the duration of your life, you want to be really careful about taking these medications long term because there are a lot of risks to them. And so if you're going to take them long term, you're going to want to really need them and have quite a lot of benefit. And finally, the last reason you might want to avoid taking antidepressants is that they can take a really long time to come off safely. Unfortunately, this has only recently been acknowledged by mainstream psychiatric groups, because for the longest time, the medical community was told these drugs could be stopped relatively quickly and that the withdrawal would be time limited and mild. However, over the last 2 decades, we have seen a dramatic increase in the number of people who are having a great difficulty coming off these meds. Now, it's not clear why some people are able to come off quickly while others are having a much harder time. However, it might be due to individual differences in the ability of the brain to readapt quickly after a medication has been removed. Individuals who are less adaptable to coming off the medication find that they develop severe withdrawal symptoms that can go on for months. And unfortunately, some of these people go on to develop a neurological injury or a type of brain damage called protracted withdrawal. This is where they continue to experience withdrawal-type symptoms which last for several years after they stop the medication. And because this isn't really a true withdrawal and it's more of an injury, even if they try and go back on the drug, the symptoms still don't go away. So avoiding long-term use is going to be one of the best ways to avoid having to deal with a difficult withdrawal when you eventually want to come off these medications. So those are my top reasons why I think people should be hesitant and should try and avoid long-term antidepressant use. As I mentioned in the beginning, given these considerations, so where do these meds even fit in mental health and psychiatry? For the vast majority of people, they should be avoided if the person is having a stressor that's going to improve in time or with non-drug supports or therapy. But if their symptoms are so severe that they're paralyzed and these meds could be used short-term to help them break out of a cycle, then I believe they could be used for this, at least for a short period of time. However, they should only ever be used in this way if concurrently there is a good recognition of the problems leading to their depression and there's some other plan being in place, so they don't have to be on them long term. Unfortunately, I don't think this happens a lot of the time. I think people just get put on them and get told to come back in a couple of months. And that's dangerous because that's going to lead to long-term use. And a lot of the times the risk is not really going to be worth the benefit. So where do I think these drugs really fit in for long-term use? Well, if you have done absolutely everything, and I mean you've looked at all of the domains that could make someone depressed, medical problems, diet, relational problems, purpose and meaning, and you've tried to change your diet, all of this stuff, and it hasn't worked, at that point, if you're still suffering substantially, long-term antidepressant use may be the only option that you have. And you should feel fairly happy about taking these medications because you've essentially done everything to explore less dangerous options in the long term. So that's the only place I see long-term antidepressant use being really a good option. So there you have it. It's my download on long-term antidepressant use and some of the risks with it. Did I miss anything? Is there anything else that I didn't mention that I should have? Just let me know in the comments below. I'd love to get your thoughts on what I've shared here.